I am Malik Shahzan reporting for GMC Anantnag. Here am I at the national conference first time in the South Kashmir on gastric tumors. Many doctors, especially surgeons, have come here for attending the conference. So come with me to the conference hall where the conference is going to begin. Let's see how the doctors will enjoy.
My name is Dr. Mumtazuddin Wani. I am professor and head of department of general surgery, Government Medical College, Anantnag.
Sir, what is the impact of smoking on gastric carcinoma?
Yes, it is a well-known fact that the smoking increases the risk of the gastric cancer.
Is there any role of chemotherapy in gastric carcinoma?
Yes, chemotherapy is one of the modalities.
इस वक्त हमारे साथ है कश्मीर के जाने माने डेवलपमेंट प्रैक्टिशनर उमर हाफिज़। तो आइए देखते हैं कि इनका जो फर्स्ट एक्सपीरियंस था इतने सारे डॉक्टर्स के साथ वो कैसा रहा। तो आपको क्या लगा ऐसी कॉन्फ्रेंसेस होनी चाहिए आगे, इन पे क्या, इससे क्या इम्पैक्ट पड़ता है सोसाइटी पे?
देखिए, मेरे लिए जब मैं यहाँ पे आज आया था तो जब मुझे यहाँ का इनविटेशन आया था तो मैं सोच रहा था इतना स्पेसिफिक टेक्निकलिटीज़ में जाना तो मेरा क्या काम रहेगा। और इनफैक्ट मेरे लिए एक अलग फील्ड है बिकॉज आई कम फ्रॉम अ सोशल डेवलपमेंट सेक्टर। तो कहीं ना कहीं मेरे लिए भी एक बहुत ही लर्निंग एक्सपीरियंस रहा। और एट द सेम टाइम आई गॉट एक्वेंटेड विद अ लॉट ऑफ न्यू टर्मिनोलॉजीज गैस्ट्रिक कार्सिनोमा में। और दूसरा ये भी है कि इससे ये भी पता चला कि जो हमारी सोसाइटियल लाइंस पे अगर हम देखें, जो हमारे डॉक्टर्स हैं उनका कंट्रीब्यूशन या उनके रिसर्च वर्क के बारे में जानने का मौका लगा। सो ऑल टुगेदर इट हैज़ बीन अ ग्रेट एक्सपीरियंस ऑफ लर्निंग फॉर मी टुडे।
आपको क्या लगा इस कॉन्फ्रेंस में नया और बेस्ट पार्ट कौन सा था?
मुझे बेस्ट पार्ट तो बहुत सारे लगे। मुझे बहुत सारी प्रेजेंटेशंस अमेजिंग लगी। और सबसे अच्छी चीज़ ये लगी कि जो डॉक्टर्स का सीनियर जूनियर का जो आपस में इनका रिलेशन है, हाउ दे वैल्यू ईच अदर, कितना पेशेंटली। बहुत सारे बच्चों को मैंने देखा, बहुत सारे यंग डॉक्टर्स को मैंने देखा, दे हैव स्पेसिफिकली कम फॉर दीज पीपल टू वॉच देम। तो ये जो कल्चर है जहाँ पे एक म्यूचुअल रेस्पेक्ट देखते हैं हम किसी पर्टिकुलर फ्रेटर्निटी में आप, तो ये अपने आप में एक इंस्पिरेशनल प्रोसेस बनता है कि ये चीज़ें रेप्लिकेट हो जाती बाकी डिपार्टमेंट्स में, बाकी सारी जगहों पे। तो सोसाइटी को एक बेटर वर्जन ऑफ सोसाइटी बनने में एक एनहेंसमेंट मिलता है, एक बूस्ट मिलता है इस सारी चीज़ों से। तो आई थिंक द कल्चर ओवरऑल, जो मुझे डॉक्टर्स का आपस में एक दूसरे की ओर म्यूचुअल रिस्पेक्ट, वो सारा मेरे लिए इट वाज रियली प्लीजिंग टू सी ऑल ऑफ दैट।
तो वैसे तो आप इस फील्ड से नहीं हो, लेकिन आज आपने पहली बार इतने सारे डॉक्टर्स के सामने मतलब ये किया है, मॉडरेट किया है सेशन को, तो आपको कैसा लगा?
मेरे लिए एक बहुत ही अलग एक्सपीरियंस था बिकॉज़ बहुत बार क्या होता है कि जब कहीं पे मेरा सेशन चल रहा हो तो इट इज़ मोर ऑफ लाइक टॉकिंग एंड टॉकिंग, बट टुडे इट वाज मोर ऑफ लिसनिंग एंड लेस ऑफ टॉकिंग। तो मुझे सुबह से आई हैव बीन पेशेंटली लिसनिंग टू दीज अमेजिंग प्रेजेंटेशंस, बट एट द सेम टाइम ये भी है कि मुझे नए दोस्त भी डॉक्टर्स की शक्ल, क्योंकि डॉक्टर्स के साथ मेरा इंटरेक्शन बहुत कम रहता है until and unless I'm not sick. But yeah, I mean, it has been a great experience. I'm happy to be here today.
Thank you. Sir, what steps must we take to decrease the malignancy in Kashmir?
It's a good question. This is what I just feel is important for the day. The message out here should be that we need awareness program. What is awareness program? People should know that anybody at 25 year, I should say, because earlier we used to see gastric cancers at 40, 60, 55. Now gastric cancer comes at 25-year-old boy or yet not married, not seen the life. What must be made aware that people should have awareness that suppose you start developing gastric problems. What is a gastric problem? Acid peptic disease. म्यादु चौकान, अगर म्यादु शुक्र चौकान at 25, you should go to a gastroenterologist, endoscopist to do endoscopy. That is the stage where you can pick up the gastric cancer at a stage where the treatment is really curative. What is the problem with us is that our cancer patients come at 55 to 70 years. They abhor they hate endoscopy. So endoscopy should not be it is for their good. So that is the problem. This tumor stays growing and we don't know. Then when he comes to us, he comes with problems of pain when the tumor becomes not resectable, and then we do only palliative kind of treatment, which is not true treatment. That is one important issue. That's what exactly happened in Japan.
Sir, is there any role of obesity in gastric carcinoma?
So it's so difficult to say. It may be, may not be. There is nothing, no proof towards that. There are many factors that have been involved, have been named in the genesis of gastric cancer, but is that true? Nobody knows actually.
So, did you like the conference?
Of course, yes. I like all conferences. This is a conference which I like from the core of my heart, and I would like such conferences to be a regular feature in James Channel.
Thank you, sir.
I am Professor Sadaf Ali. I work at Sher Kashmir Institute of Medical Sciences as a professor in Department of GI Surgery. So I'm a surgeon specialist.
Okay, ma'am. Ma'am, what is the role of this pickles and dried vegetables in gastric carcinoma?
Okay, you're asking an interesting thing. The theme of the conference was very interesting because it was on gastric cancers. Gastric cancers are very, very common in Kashmir. I, as a dominant pancreatic surgeon, I try to do more pancreatic surgeries. If I have achieved 20 as a complement to 100 pancreatic surgeries, I must have done 200 gastric cancer surgeries. So the load is so much, and I think somewhere the eating habits in our population has to be there. As the sciences says that kind of things like pickles have a lot of preservatives, and preservatives tend to increase the tendency of stomach becoming hypogastric and malignancies becoming more common.
So, what is the reason for the increased rate of malignancy in Kashmir?
The reasons are multifactorial. If we knew what are the real causes, then we would prevent them and there will be no cancer. But as of now, in majority of the cancers, the real cause is not known. Now take the example of gastric cancer. There are so many risk factors, but there is no correlation. Nothing is proven except there are chemicals which is called nitrosamines. The contamination of foods probably is causing, that is one of the factors. Then there are infections. There are one infection that is called H. pylori infection. That is one of the causative agents having a correlation with development of gastric cancer. And then there are hereditary factors as well. So you have got preventable factors like smoking, alcohol, etc., dried fruit, salty, so many things which you can curtail and prevent the gastric cancer. But then there are some factors where there is no control. Means hereditary factors. Then there are so many other factors where you don't have any control.
Today we have Dr. Azad, the renowned surgeon of the Kashmir Valley. So let's ask some questions about the gastric carcinoma. Sir, I will take you 2 minutes. Will you answer 5 questions?
Okay. Yes.
So does the gastric carcinoma mostly occur in females or males?
No, actually it is more common in males, less common in females.
Sir, what is the reason?
The reason is that males smoke more, because in the case of malignancies, gastric carcinomas and even other malignancies involving the GI tract, gastrointestinal tract, male malignancy more because of eating habits. Because males eat more meat, they do more outdoor activities. In outdoor activities, they are involved in barbecues, more smoking, more alcohol. Those are the reasons for more malignancies of the stomach, GI tract.
So does the early diagnosis lead to high cure rates?
Yes, definitely. Early diagnosis leads to high cure rate, and early diagnosis means early detection of the tumor. If you early detect the tumor, definitely you have get good results. And early detection of tumor means endoscopy. These days we have high-level endoscopes, endoscopic ultrasound, or capsule endoscopy. Many other things are there. काफ़ी development हुआ इस चीज़ में, काफ़ी progress है university. But only the thing is that patient should come first. Patient will come early so that you can detect early and treatment will be better.
So did you enjoy the conference?
Yes, definitely enjoyed it a lot. It was the first experience of South Kashmir, although I have participated in many of the conferences, but this was certainly a great conference with a great enthusiasm, great education purposes, and I hope in future these things will continue.
So that was this conference a chance for you to learn something new about gastric
This is
conference?
always the conference always increases our knowledge because there are always surgeons that are from different parts of the valley that are know about and they are the senior surgeons and they give us about the new techniques and what they have learned throughout their life that they will talk us about them that we learn from them.
So did you enjoy the conference?
Yes, we are definitely enjoying because we learn a lot of things that will benefit also to the patient. That is why we learn.
Thank you for your attention. The last session has just concluded. Thanks to the Principal Dean, the HOD Surgery, the doctors and the surgeons that they have attended this conference. Thanks to the management that they have organized such a big and great conference first time in South Kashmir. I am reporter Shahzan with cameraman Faiz Khan reporting for GMC Anantnag. Life is a small gap between birth and death. So enjoy every moment of your life and be happy. Thank you.